It is Wellness Wednesday, and October is Breast Cancer Awareness Month. In this sponsored segment, we welcome to the show Dr. Sasha Spenceley. She's a general surgeon at Memorial Healthcare Surgical Associates. She's talking about the support breast cancer patients can receive as they face a diagnosis. Good morning to you.
Good morning.
Yeah, thanks for coming here to talk about this. I mean, you know, I know that patients face a lot of questions, and you have answers for them. We'll start with, what are some of those treatment options that are available for someone who's been diagnosed with breast cancer?
So when you're diagnosed with breast cancer, there's a whole host of treatment options that we'll go through with them. There's a wide range of surgical interventions, so lumpectomy, mastectomy, reconstruction. There's also additional therapies such as chemotherapy, radiation, and endocrine therapy. But the treatment for the cancer is very nuanced and patient specific. So not just because you're diagnosed doesn't mean you're going to get all those treatments. It's very dependent on patient age, tumor hormone receptor status, and stage at diagnosis.
So it sounds like it is a case-by-case basis. And talk about how you will walk a patient through something like this, because it can be tough to hear those words that you have breast cancer.
It's hard because you don't know what the patient is processing at the moment when you tell them that. It's such a huge diagnosis to receive. Having loved ones there to help support them is really key to this, especially having them in the patient room with us when we're going through the diagnosis, because they may or may not be absorbing anything you're telling them, and you're presenting them with a now 6-month treatment plan and what their life is going to look like. So having someone there to have an extra ear, and you can tell that they step in and ask the important questions that patient might not be processing at that time.
Definitely, it is a life-altering moment, and having that support can make a difference. What can someone do to lower their risk of getting breast cancer?
So there are specific things you can do to decrease your risk of recurrence. That is additional therapies like we talked about, chemotherapy, radiation, and endocrine therapy. But in the absence of a diagnosis, you can also lower your risk by decreasing your modifiable risk factors, such as alcohol intake, either limiting it to nothing or less than 3 drinks a week. Physical activity, 150 to 300 minutes of moderate intensity activity weekly, and maintaining a normal body weight or a BMI between 20 to 25 all decrease your risk of getting breast cancer. Other things that decrease your risk are having children and breastfeeding.
So there are some proactive things there, especially with lifestyle choices. Let's talk about men as well. They should be aware of their risk, right?
100%.
There's a risk there.
It's not just a female-specific cancer. Men do get breast cancer. There's a lot of typically familial or genetic components to a male breast cancer. So having a family risk of prostate cancer or a family risk of breast cancer, your sons and your male family members should also be screened.
Yeah, important information to keep in mind. Bottom line, you will walk a patient through everything they need to know, right?
Yes.
We thank you for what you do. And for more information about those surgical options and the information we talked about, you can go to memorialhealthcare.org, or you can call that number that you see there on your screen. Thank you so much, Dr. Spenceley, for your time. We appreciate it.
Thank you.
Good to see you.